My name is Ruchit Nagar, and I'm here to tell you about Khushi Baby. Khushi Baby means happy baby in Hindi, and it's our goal to have happy and healthy babies around the world. Unfortunately, 1.5 million children under the age of 5 die every year from vaccine-preventable disease. Now, we have vaccines, but the bigger question is who is not getting them? And that's much harder to answer. So consider the case of rural India, where a mother walks with child in hand for half an hour in order to get to a makeshift campsite. This camp occurs once a month. She presents her health card, which she has to hold on to for 2 years, to the health worker. Now, this card is often lost, forgotten, or not filled out. And what happens? The health worker has to reference a logbook, but ultimately ends up asking, was your child born before or after the harvest, in order to determine which vaccine to give to the child today. We think that we can do better, and we've built a technology platform that allows us to redefine the health record from the ground up. So what are the components of this technology platform? We give health workers an Android application, and we give patients the ability to wear their medical history for the first time in the form of this necklace. Now, this necklace has a near-field communication chip that stores 1 kilobyte of data. This is off-the-shelf technology that allows us to store the child's vaccine history, for example. It's durable, waterproof, does not use a battery, and most importantly, this black thread has a culturally symbolic meaning that's relevant for sparking engagement towards things like immunization in these communities. So now, let's switch over to a demo and see what would happen if a child were to come to a camp that's using the Khushi Baby system. So here I have the Khushi Baby app on my phone, my Android device. Can you all see it? What we're going to do with the new patient is we're going to start off by entering in some basic identifying information. So that's me, Ruchit. This doesn't take too long, but this is the only time that we have to actually enter information. Now, we collect the phone number so we can give these families automated voice call reminders in their own dialect. This is my phone number in case anyone wants to get in touch with me after the demo. Okay, so we've generated a unique ID for the patient, and now it's time for us to initialize their health record. There you go. So what we see here is for this child, the vaccines that they need, when they're due, and when they've been given. With a simple tap, we can see which vaccines are due today. In this case, OPV1, DTP1, but oh wait, we can't give hepatitis because we're out of stock. Well, with our app, we can actually record that, and it's important for us to know what the true demand is. The only way we can know that is by also recording failed encounters. So now that we've entered the data and given the vaccines, it's time for the magic moment, to save the data and update the patient's record. There you go. So now, let's say the child goes to a different vaccination camp in a different village the next month. And there's a different health worker, and the health worker is using a different tablet. And the tablet isn't synchronized. Well, we don't have to start from scratch. We know that this is an existing patient, and what we can do is we can just scan. And here you can see that last month, if we can zoom in here, the baby did not get that hepatitis shot. So this all happened without connectivity, no strings attached. The big picture takeaway is that we've decentralized the health record. It allows the patient to have a digital interface to the health provider anywhere in the world. And this is more than just frugal innovation for rural India. What it really represents is a new paradigm for thinking about how we address the interoperability challenges between health providers. We can store a lot more than just vaccines on this record in 1 kilobyte. This is about letting patients own and literally wear their medical history. With the support of groups like UNICEF and Gavi, we are poised to scale this up across multiple countries in the coming year. And Khushi Baby can only grow with your support, your ideas, and your participation. All it takes is something as simple as wearing a necklace. And I'd like to leave you all with one question. Where are your medical records?